right now, the World Health Assembly is taking place in Geneva, Switzerland. And so this is really a globalist health gathering. The World Health Assembly meets every year in Geneva this particular week from May 27th until tomorrow, June the 1st. And they are the decision-making body, so the governing authority of the World Health Organization. So if you are having a hard time, like I am, keeping up with how many globalist gatherings there seems to be in any given year, this is certainly one to keep your eyes on, because they vote, amend, and rule by dictatorship and diktats to the rest of the world what is happening in the health sphere. So, of course, our very own health necromancer, Canada's, actually, I don't like to call her Canada's chief. So the interesting thing about Theresa Tam, she's the Chief Public Health Officer of Canada, but she actually wants to be called Canada's Chief Public Health Officer because she wants to make it seem like, she has ownership of Canada, I suppose. We discovered that in an access to information request.
Wow.
So I always like to refer to Tam as Chief Public Health Officer of Canada, not the other way around, because that's her preference. And, Tam just really gets on a lot of people's nerves for the way that she has handled the COVID pandemic, promotes these novel injections for everybody, but especially children, babies, and toddlers, and, continues to really want to enforce and rely on this sort of biosurveillance state with tracking and digital IDs and pandemic measurements and routine immunization. I mean, the list goes on and on. But anyway, she has been at the World Health Assembly this past week representing Canada, despite the fact that she was not elected to do that by anyone here in Canada. And we have a really great clip of her at one of the plenary meetings. So at the World Health Assembly, they have committees, and these are all live streamed, but many of them happen at the same time. So for one person to follow and try to keep up with what is happening at the World Health Assembly is next to impossible, because there are so many events happening at the same time, and those are live streamed. But there are also events that are not live streamed, and they're called side events. And we've discovered, I'll have a report out later today, actually, we've discovered that Tam partook in one of these side events, and it's very, hush hush. There's not a lot of information out on it. So I kind of dissect what we do know and what I've tried to obtain from our wonderfully transparent government, as they would have you believe, but turns out they're not really. So speaking at one of the plenary addresses that was live streamed, this is a clip of what Theresa Tam had to say. And actually, as a precursor, before we show the clip, at the World Health Assembly this week, they are discussing the amendments to international health regulations. So there are 300 proposed sweeping amendments to this existing international legally binding law, the international
300?
health regulations. 300 amendments are being proposed, and they can't even agree on them. So it's a lot of rigmarole, and this dates back to roughly 2 years ago. The WHO has been really keen on strengthening its mandate since the COVID pandemic pandemonium ensued. And I guess they just didn't have the authority that they so desperately want and need to control global health responses, even though we basically saw that almost the entire world kowtowed to the whims of whatever Director General of the WHO, Tedros Adhanom Ghebreyesus, wanted to see done. And so we already did that. But for whatever reason, the WHO wants to strengthen their mandate. And I mean, a lot of it, I would say, just means get more funding. But nonetheless, they're there this week. The most pivotal themes are the IHR amendments. So that's amending existing international law, which would have sweeping repercussions to our national sovereignty and future pandemic responses. We know that there's disease X. So this is a placeholder for all of those future diseases that Tedros has told us is not a matter of if, but when they come. And then there's also a new pandemic treaty. They can't quite get the wording down, so it'll be a pandemic treaty, an accord, or an agreement. So these two changes and new agreement will really complement one another to strengthen the WHO's mandate. And There's been a lot of opposition to this, including here in Canada. Our own MP, Leslyn Lewis, has been an outspoken advocate against rushing either of these pieces through, and she's been denouncing them. But in case you were doubting whether or not Health Canada and the Public Health Agency of Canada, overseen by Theresa Tam, was listening, we can hear from Tam herself that they are in fact leveraging to move forward.
Together, we must improve health promotion efforts to reduce disease burden and foster mental and physical health and well-being. An integrated approach to essential service delivery requires the inclusion of nutrition, sexual and reproductive health and rights, and routine vaccination. This also means strengthening both external and domestic financing for health, which is why Canada is invested in the Lusaka agenda. We must also step up our efforts to address systemic and historical discrimination against Indigenous peoples within our health systems. Gender equality is foundational to a peaceful, prosperous, and sustainable future for all. Let us continue to fight racism, sexual and gender-based violence, and discrimination against marginalized groups, including 2S LGBTQI+ people, women, and girls. And let us renew our support for those on the front lines of care. We have a collective responsibility to ensure the protection of our healthcare workers and condemn the unacceptable attack on them and on health facilities. The many conflicts in the world, including Gaza and Ukraine, serve as stark reminders of the fragile nature of accessing critical health services. Canada urges all member states to support WHO's critical health emergencies work. A strong WHO must also be inclusive, reflecting the entire global community. This means supporting Taiwan's meaningful participation as an observer at the World Health Assembly. This week, we will collectively decide on next steps on both the pandemic agreement and on the IHR amendment and negotiations. Canada remains committed to continuing to work together to prevent and minimize the devastating consequences of future global health emergencies and pandemics, and to further advancing health equity for all. A meaningful pandemic agreement is consensus-based and one that member states can sign, ratify, and implement. Thank you very much.
Wow, Tamara Ugolini, you are way more up to date on these World Health Organization shenanigans than I am, but I want to hear what you have to say. I'll tell you what I took from that. That was the first time I saw that. And I got to say, there were more red flags in that 2 minutes of woke world salad than you would find at a bullfighters convention. But first of all, routine vaccinations, like experimental vaccinations for viruses that don't exist, but they're coming. Trust us, they're coming. We didn't let you down from 2020 till 2022, did we? Well, yeah, you did. Gender equality, and then she does that whole initial gram for whatever the Rainbow Mafia goes by these days. I can't keep up. That sounds to me, code speak for trans women are real women, guys pretending to be females are actual real females. I think that's what she means by that. Bringing up Gaza and Ukraine, lady, stick in your lane. What does that have to do with health? This is a geopolitical matter. It's war. It's not health. I mean, she's all over the map. What did you call, Tamara, that we call these side events? You know what that reminds me? Back in the glory days of the circus sideshow, which is to say you'd have the main circus, the three rings under the big tent, and you'd see the marquee acts like the lion tamer and the trapeze act. But outside the big tent, you would have the circus sideshow acts. It would be like the geek biting the heads off chickens. So yeah, that I think it's a good analogy to have an equivalence to the circus sideshow of yesteryear by calling this a side event. Your thoughts?
Yeah, I had a nice little mental image there of Sideshow Bob from The Simpsons and Theresa Tam. But anyway, maybe some meme generator can work their magic there. Yeah, having to fit in all, like, I think she hit almost every social justice buzzword there possibly was before she made sure that she noted we recommit to the IHR, those international health regulations, and the pandemic treaty. And that's really interesting because that was one of the things that Leslyn Lewis, she penned a letter earlier this month to federal Liberal Health Minister Mark Holland, and basically stated in there that there are certain things housed within these amendments in the pandemic agreement that aren't really related to health. And so one of those things is the climate change hysteria or the climate alarmism that we see coming out of the Liberals.